not going to discuss the criteria necessary for the appearance skill evaluation. We like you to arrive in the clinic in clean, laundered, well-pressed scrubs. If you just take them out of the dryer, usually they hang up fine, they don't wrinkle. I wouldn't leave something sitting in the dryer if the scrubs are dirty or soiled. Obviously, they need to be cleaned. They need to be cleaned after you wear them each day. So clean scrubs. Check your hems for little stragglers, worn hems around the shoes. Everything needs to be clean, neat, and tidy. You'll wear your name tag in the left shoulder area. You'll have a radiation badge in the pocket area of your scrub top. Pockets are in different areas on different scrubs. Sometimes the pocket is up here in the chest area. Depending on the scrub, it'll be down in your waist area. It's just important that the radiation badge is somewhere between your waist and your shoulder. So you want to make sure the badge is there. I don't care if it's on the outside of the pocket or on the inside, just make sure that it's there. Okay. It's an option to wear a white t-shirt under your scrub top. That's up to you. It's just for modesty. What I will caution you about is it gets very warm here in the clinic. By the time we put on our disposable gown, which I'm going to put on right now, if you have a t-shirt and your scrub top and your disposable gown, it gets very warm. But if you feel that you need a white t-shirt underneath your scrub top, that's fine. We also wear a disposable clinic gown when we're here in clinic. These come as part of your student kit, and again, this is worn whenever you're treating patients, not when you're seating patients, but when you're treating patients. So this is your disposable clinic gown. Your hair needs to be confined, all right? So you see my hair is pulled back. There's a little bun in back. It's not a loose hanging ponytail. It's all confined. Your hair needs to be clean and of a natural color. We have students every year who like to kind of push the parameters of the natural color aspect of our skill evaluation. No purples, no pinks, no blues, your normal blonde, brunette, redhead colors. Any sort of hair accessories that you need to confine your hair need to match your hair color. So confined, if your hair touches your shoulders or touches your collar, it needs to be pulled up away from your face. In terms of your hair, also what you want to be on the lookout for is no loose tendrils. Not anything hanging down, everything is off of your face. So when you're leaning over to treat your patient, nothing should be hanging around your eyes, around your eyewear, around your glasses, on your face. No body adornments. That specifically is speaking to ear piercings. We can't have pierced ears. Obviously, you can't wear nose piercings anywhere on the ear. No facial piercings, nothing of that type showing. On another aside, tattoos are also not to be showing. So if you don't have any tattoos and you're thinking about getting one, don't get one while you're a student here in the clinic. If you do have a tattoo and it's in a visible area, sometimes we see them on the back of the neck or the wrist or the forearm, they will need to be covered while you're treating patients here in the clinic. In terms of your personal hygiene, you always need to be clean. Be very aware of body odors. Wear your deodorant, wear your antiperspirant. We work very close to patients. We often are within 18 inches of the patient, sometimes even closer. So your body odor is something you need to be aware of. And along those same lines, no strong fragrances. Perfume that might be appealing to you might not be appealing to your patient. I don't know if you've ever had the experience of having to be stuck close to someone whose fragrance you couldn't stand. We don't put our patients through that. So just clean personal appearance, no strong fragrances. We also have a no jewelry dress code in terms of our appearance skill evaluation. So again, no earrings, no necklaces, no bracelets, no watches, no rings. We do allow a plain band in place of your wedding band, a plain gold or silver band. However, I will caution you, studies show that they have found oral streptococci under plain gold wedding bands, culturing them after people have treated patients wearing gloves, washing their hands. So no rings are ideal. If you need to wear a ring, a plain gold or silver wedding band is acceptable. All white leather clinic shoes. We have to have all white clinic shoes. We prefer the lace-up style or the loafer style that covers the heel. We don't want a clog style shoe, a croc style shoe. We will take off our clinic shoes when we leave campus. So to go across campus to the cafeteria to get food, if you're coming into clinic from your car or going out to lunch, you change into a different style shoe. So for that, a croc or a loafer style shoe is fine. So a plain white loafer style shoe or lace-up shoe, clean white laces, and I'm going to touch on socks while we're here. You want a sock that is full ankle coverage, so when seated, if your pants come up, the ankles need to be covered. So we don't want the little ankle sock, the no-show sock, those we don't want. We want a sock that covers your ankle in this manner. I also don't want your brother's dirty athletic tube socks in here as your white sock that covers your ankle. Get the appropriate socks. In terms of face, we just want to make sure your face is clean. Makeup is fine in moderation. You don't want a lot of heavy makeup, the type you'd wear if you were going out for the evening. Obviously, I'm wearing makeup. It's fine in moderation. For men, you need to be clean shaven, or if you have any facial hair, it needs to be confined to the area that can be contained underneath the mask. So right there. Your eyewear needs to be OSHA approved protective eyewear, which will be some sort of side shield eyewear like this. You can purchase this at most stores. It doesn't necessarily have to be a uniform store, the Andersons, something that has a side shield. This is acceptable. Other types of acceptable eyewear will be the full face shield. You can have something like this. When you wear a full face shield, it's important to remember that we still need to wear a procedure mask underneath. Other options include these googles. These are passed out as part of your instrument kit. They can be for you or for your patient. These are nice and lightweight. I like them because as you lean your head forward, they don't fall down on your nose. It's not OSHA protective eyewear if while you're wearing it, when you lean forward, the eyewear is like this. Debris is coming up over the eyewear. It's not protecting you at all. A way to test your eyewear, put it on, make sure when you lean your head forward, it doesn't fall down your nose, right? I will wear loops. If you have loops or something like this that don't come with their own eyewear, you can purchase side shields, or if you have your own prescription glasses, these little plastic side shields are available, I believe, in the bookstore, and they just slide over your glasses. My eyewear for clinic are my loops, and I have protective side shields, and that's my OSHA approved eyewear. So those are all options for eyewear, but you just make sure you have shields and make sure they fit properly on your face. Your hands need to be clean, your nails need to be short, and we always check short nails by doing a couple of things. If you hold your hand up, you shouldn't be able to see nail tips over the tops of your fingertips. Now we can all play that game where we tip our fingers way backward and say, I don't see any nails sticking over the end of my fingertips. You know what an appropriate nail length is. You can have a little bit of the white of the nail still showing, but we just want short nails. You're going into people's mouths. You don't want to pinch their tissues and make them uncomfortable when you have your hands in their mouth. In addition, short nails are much cleaner, so for your own protection in terms of infection control. Then we also look at the cuticle area for signs of nail biting. Some people bite their cuticles, any sort of weepy dermatitis or torn, ragged cuticles. I'm giving you plenty of time to get your hands in order. So clip your nails, get some good lotion on there, stop biting your nails, get it under control before the first week of clinic where we do the appearance skill evaluation. Okay, go ahead and flip the page, Pete. Obviously, no nail polish, so if you're someone who likes to wear even a clear nail polish or a light nail polish, the edges of nail polish hold bacteria, so no nail polish in clinic as well. And that's the end of our appearance skill evaluation.